He's complaining of upper back and low back stuff here, along with knee and foot. But what we want to look at first is let's look at the overall contour. Now, we look at the overall contour, we have a little bit of dishing in the spine here, in this area. It goes in, so he probably has some damage in here. Here you can see the spinous processes. And you can see that the spine does, from here, curves like this, like this. You feel my finger?
Mm-hmm.
So there's some curvature going on here in the spine, okay? And it looks like that's where it's starting from. So we're getting a big pressure reading at the base of the neck here, C7. Now, whenever you've had these pains, what have you done for it to make it feel better? Excuse me. Nothing? Deal with it?
Yeah.
So the idea is you got to be at your optimal best so you can work and play as hard as you want, you know? So we're definitely also getting a big reading down at the base of the spine. Remember I was telling you in the tailbone area?
Mm-hmm.
Here, here, and here. Those are the three big readings I'm getting. The next thing we need to do is static palpation. I'm going to be feeling the spine. Head down, please. And let's just run the fingers. And what you can start to see here is the tissue changes start in this area around T5. Keep going, orange peel, and it's right about here. So out of all of them, it's starting down here, okay? But when I'm pushing, is it more tender to you here or here?
Yeah.
Top one, right? Yeah. Okay. So around 7, 8, T7, T8 area. That area, guess what? Also controls your sugar. So all that cervezas too. Sit up straight, feet together, and I want you to open your knees, open and close your knees, but keep your feet touching. I'm going to be feeling back here your SI, your sacroiliac joint, your hips. Right side only, left side only. So when he does the left side, the right is good. But when he does the right, do the right, this wants to go with it. Does that hurt to sit up? No? Because Mario, you're supposed to sit like this, but your spine won't let it because it wants to be the other way. We need to be like this, okay? That's not moving down. You feel this here?
Mm-hmm.
Okay. Now, does it hurt? Is it more tender when I push here or here? Ahí.
Yeah.
Sí. And let's feel the sacrum. ¿Duele?
Yeah.
Sí. ¿Mucho duele arriba o abajo? Both?
Yeah.
Okay. So then we go at the bottom. Duele aquí, ¿sí? Ahí?
It does, but
Not like here.
yeah.
Okay. C7, T7, sacrum, left pelvis. So right side doesn't go as high. Now you see when I'm doing this, it's catching.
Mm-hmm.
You feel that?
Yeah.
That will probably change today after your neck adjustment, okay? You'll see. Both sides, yeah?
Mm-hmm.
So there's a lot of crepitus grinding. There's not a smooth glide of both shoulders. So first thing, looking at the feet, okay? We can see this heel is higher than this side, number one. Number two, we can see rotation of the tibia. Duele?
Yeah.
Duele, but not as bad as this side. So I agree with what you said. You said the injury, there was this. This was compensating. This is a problem because it started with this.
Mm-hmm.
Okay. Now, whatever happened on this, okay, it affected your pelvis, your hip.
Mm-hmm.
And remember, when you look at the hip, so left hip, what goes in here in the hip?
Mm-hmm.
Your femur.
Yeah.
And then the femur connects to tibia, the knee.
Mm-hmm.
So this and this starting. So we got to look at the posterior tibia on that side, AIN femur on this side. Bilateral talus issues. Let's go ahead and just check dorsiflexion. So it doesn't want to go up on that side, on the medial side. Let's check the other side. That's there too, but that's not really from the foot. That's coming from up there. Now, you roll these two bones here, right? These two.
Yeah.
These two, are, you can already see the swelling here on his cuboid, right here. Nice, big, and puffy. These two fingers or toes, they go to this bone, the cuboid.
Okay.
When you rolled it, this thing popped up. If that pops up, then those two bones don't sit properly. It's always going to be off. That's what you've been feeling. And to avoid the pain, you started compensating on the opposite side. It rocks on an arc. On here, it rocks on an arc. Do you feel this? Now watch this. It's not going up and in the same. So we got to work on your ankle and the cuboid here. We're going to do C7 as a PRS. Right hand up, please. So, and then what we wanted to do immediately after this adjustment is check his range of motion in the shoulders, okay? If we're doing our job correctly, then it should be a little bit better. Look up. There you go. Gotcha. Now, from what we just did there, Mario, let's see. Dígame.
Yeah.
What's different?
It's not going.
You see that?
Yeah.
Okay. We're going to do the low back here, okay, first? Nice and easy there. So I'm setting sacrum. We're going to start the process here. Good. Can I have you bring your chin up, Mario? Home run. I got you. Beautiful. 2, 3, 4, 5, 6, 7. Perfect. This is already changed. Beautiful. So we had a big reading on the right at C7T1. It's already come down more than half. T7 is clear. Nice. Sacrum is clear. 1 point. Now, when I push on here, that should feel different now, Mario.
Yes.
Correct?
Mm-hmm.
That already feels better to me. See?
Yeah.
I am going to need to work on that pelvis. We'll wait till we get the film on that. 7 clear, that's clear, that's clear. Now what's interesting here, Mario?
Mm-hmm.
It's your left shoulder that's really the problem, not your right. Okay? Drop it down, elbow down. There you go. This one, over, around, down. There you go. What I'm going to do is start on the ankle. I got to work the swelling and scar tissue out, okay? We get the scar tissue out and work this properly, then we actually fix it. If we don't do this, we can make some sound, you feel good, it doesn't get fixed though. I go a little bit deeper each time, you can handle it. If you can't, you just tell me.
Okay.
But I know you can. So this is working what we call the periarticular swelling, that's the swelling around the joint and the scar tissue. Next we're going to do passive range of motion and do the intra-articular. Now, I'm going to go a little deeper. There it is. There you go. 3, 2, 1. Slide down just a little bit, and now I'm going to set your ankle. Oh, tight. There. Nice. Now, you may get some crackling sounds in your left ankle as I'm breaking up that old scar tissue, but we're also putting it in the right place so it heals properly. Just 2 push-ups. Make sure there's no pain in your upper back when you do that. No pain, right? Okay. And I want you to come up like this and tell me how that feels on your low back. Should feel better. Okay? That's where we're going to start with you today. Last thing I will do is your elbow. Okay? Okay. There you go. Give me this thing. Distal radius. There you go. Go like that 5 times. So it's better, but it's still there.
Mm-hmm.
This should be way better. Yeah. Okay. Mario, you have any questions for me? That's where we're going to start. Okay?
Okay.
Welcome to the office.
Thank you.
You're welcome.